-10 outside. You're bundled up in a warm hat and mitts, driving to work in a freezing cold car, only to arrive and get into a screening line with your coworkers outside. You slowly move your way to the front of the line, where a laser thermometer gun is pointed at your forehead. All that stands between you and the start of your workday is that gun reading less than 38 degrees Celsius, the COVID-19 fever cutoff. Before the pandemic, this whole situation was unheard of. Temperature checks were mostly reserved for medical appointments or for when you were at home sick in bed. Nowadays, temperature checks have become the norm in workplaces around the world. Sorry. Um, Pop-up screening stations have been put up in foyers, tents, trailers, and in drive-throughs, all in hopes of preventing a COVID positive worker from walking through the doors. But with workers being exposed to scorching hot and freezing cold temperatures, both things that can modify skin temperature, calls into question whether or not these devices can really do what they say they can. The big concern is that thermometers have never been tested in such harsh environmental conditions, so they could be easily over or underestimating fever temperatures. Our research tackles this issue by measuring how different thermometers perform in a wide range of environmental conditions. We tested an ear and forehead thermometer, a laser thermometer, and a thermal imaging camera. Using an environmental chamber, our participants were exposed to temperatures of negative to plus 20 degrees Celsius for 5 minutes, and then their temperatures were taken with each of the devices. We then repeated this protocol in real outdoor conditions. What we found is that outdoor temperature screening is not accurate in outdoor temperatures of less than 20 degrees Celsius. Additionally, we found that screeners should be waiting at least 5 to 10 minutes after workers come in from outside before taking their temperatures. Lastly, we found that the ear thermometer was the most accurate device, the thermal imaging camera was the most accurate non-contact option, and the laser thermometer was the least accurate device, underestimating forehead temperatures by up to 9 degrees Celsius. During times of uncertainty, like the current pandemic, we rely on what we think is best until we know more. Now that we know more, we trust that our findings will allow workplaces to refine their screening protocols and to ensure that workers can arrive home safely to their families COVID-free.